Hey, this is Dr. Marshall Green with Coastal Aesthetic Facial Surgery. We're here today to do some Kybella injections. This is Michelle. She's one of our great patients, also happens to work here, and so you may have seen her in one of our videos before. We've done one series of Kybella injections on Michelle before, and she's back for the second round, which is pretty common with Kybella. I'm seeing a lot of folks for 2 treatments instead of just 1 treatment, like some people might expect. The second time around, get a great response after the first treatment is resolved for 2 to 3 months. So Kybella is a deoxycholic acid. It's designed to literally melt the fat in the subcutaneous area, as opposed to liposuction or open resection or something like that of fat like we have in the past. This is an injectable, just like Botox. You inject it, it literally melts the fat away. So you can see here we have an ice pack on. Otherwise, you don't typically use a lot of local anesthetic when you do this. So you can go and take that off for us here. A couple things to note when you're going to do Kybella injection, just some landmarks to mark out. So typically you're going to stay about 1 centimeter to 2 centimeters away from the inferior border of the mandible. That's to protect the marginal mandibular nerve. And then also, if you watch our training videos, they'll have you mark the SCM, the sternocleidomastoid muscle. You can also just mark the lateral aspect of where you plan to inject down to the cartilage, the thyroid cartilage down here, and continue to the other side. Now what you see here is this dot pattern, which comes with the product. You put that on like a temporary tattoo, and that kind of indicates the areas in which you want to inject. Most of my patients, I'm starting out with like a 2 vial injection. Someone with maybe a larger neck, a significant amount of subcutaneous tissue, you might go to a 3 vial injection. However, if you want to be very precise, you count the number of dots within the area you want to inject. You can kind of pinch that area to see the area you want to inject. Mark the dots out, count them, and you're going to be putting 0.2 mLs into each dot. So basically you can double the number and move the decimal place over once, and that's going to tell you how many mLs of solution you're going to need to inject. So if you do a lot of Botox injections, the biggest difference is you're going to be pushing 2/10 of the product of SCC instead of your normal 1/10 or 5 units what you typically inject with Botox. So it may feel a little bit different at first. So here we go. You ready? Yeah. Okay. All right. So we're just going to come in here and we're going to start injecting. I'll typically start in the midline. All right, just in the subcutaneous tissue. You typically want to be perpendicular to the skin. And like I said, we're going to do 2/10 per site. And then you don't want to go deep, so deep enough, so deep that you'd be into the underlying musculature. You just want to be in the subcutaneous fat. So, and then just follow the grid pattern. You have a gloss? How you doing there? Not too bad? And then as far as what most patients describe, I'm sorry, I'm in the way, as far as pain or discomfort, I think the last time we said you had like about a 4 out of 10 pain, 4 or 5 out of 10 pain. So I do typically give my patients a prescription for a couple of pain pills. Most likely it's used in the first night. After that, it's typically not used very often. As I come out laterally, a lot of times I'll kind of point my needle at a more lateral position, so you don't have as much fat in this area. It's more of a feathering effect into the lateral aspect of the subcutaneous tissue, and kind of getting away from that big central bulky deposit. So you can kind of tailor this. If you want to do the exact amount perpendicular to the skin every time your first go round, I just have found this kind of nice feathering effect laterally as I kind of get away from that big bulky deposit of tissue in the midline. Come back over here. Feather on this side. And then we can put the ice pack back on at the end. You want the ice or not? Mm-hmm. Okay. All right. Very good. All right. once again, that's Kybella. That's pretty much how it works. Pretty straightforward. It's the new non-surgical neck lift. A great product, great procedure. Patients seem to really enjoy this so far. So check us out, theaestheticface.com, Coastal Aesthetic Facial Surgery. Thanks so much.